you think about the different components of the nerve. And I like to think of a nerve, as like a coax cable. It's got, a hard kind of outer layer, and then it's got all these fibers on the inside. And the main fiber is the axon. And that's the main unit of the nerve. And then you've got bundles of axons together that are grouped, by this so each axon has its endoneurium, and then you have the number of fibers grouped together and by the perineurium. And you have your groups of fascicles, encased by that perineurium, and then with you have this kind of squishy layer on the inside, the internal epineurium, and then all of that is just kind of grouped together by the epineurium. And the epineurium has its own, blood vessels on it, and that's what you see when you think of a nerve. You see, almost like a wet noodle with a blood vessel running along it. That is what
Yeah.
you see. You see the external epineurium with that vessel running along it.
And more into the, the blood supply of the vessel. Can you kind of go over some of the arterial systems, like how do these nerves and these axons get their blood supply?
Well, so I mean, they get blood supply from vessels that run longitudinally along those nerves. And segmentally, you'll have small little branches coming off of those longitudinally running vessels, those nutrient type vessels that will feed into the external epineurium. And then eventually those vessels will give small little branches into the nerve, within the nerve, between the perineurium, the bundles of the fascicles. And so you have all these vessels inside the nerves too. So if you ever seen a nerve like cut back to healthy fascicles, you'll see this kind of bleeding within the nerve. And those are the small little nerves within, the small little vessels within the nerve that indicate that you're back at healthy nerve if you're cutting back to healthy fascicles. If you're in a scar zone, you're not going to see a healthy blood supply to that nerve. Um, so I think that's one thing that is super important if you're when you're treating nerve injuries.
Excellent. And kind of just to review that, we spoke about the endoneurium, which pretty much surrounds that axon, and then you have the perineurium, which surrounds those fascicles, or those bundles of axons. And you have your inner, epineurium, and then your epineurium. And then you can also see your blood vessels on top of that. Now,